Assalamualaikum and hi to my respected lecturer and my fellow classmates. My name is Farhana Binti and today I will be presenting my infographic entitled Ethical Communication in Hospital Emergencies. Before I begin, imagine an emergency department where a patient arrives in a critical condition after a serious accident. Doctors, nurses and paramedics have only a few minutes to assess the patient and begin the treatment. In this situation, every instruction and every decision depends on effective communication. A single misunderstanding can delay treatment or even cost a patient's life. Therefore, communication is not just about exchanging information, it is a professional responsibility and a life-saving intervention. Now, if we look at the top section of my poster, it highlights the four ethical principles that guide communication in emergency healthcare. These principles are based on the ethical framework developed by Buchem and Childress. The first principle is autonomy, which means respecting the patient's right to make informed decisions whenever possible. Even during emergencies, healthcare professionals should communicate honestly and obtain consent if the patient's conditions allow. The second principle is beneficence, which means acting in the patient's best interest. Clear and timely communication enables healthcare professionals to provide appropriate treatment without unnecessary delays. For example, when a nurse immediately reports a patient deteriorating condition to the doctor, prompt communication allows faster intervention and improve patient outcomes. The third principle is non-maleficence or do no harm. Poor communication such as incomplete handovers or unclear medication order can lead to preventable medical errors. Therefore, verifying information and communicating accurately are ethical responsibilities. Lastly, confidentiality requires healthcare professionals to protect patients' medical information and share it only with authorized personnel. Maintaining confidentiality strengthens patient trust and professional integrity. Next, I would like to explain communication among healthcare professionals. Emergency care depends on effective collaboration between doctors, nurses, and paramedics. Communication must be clear, concise, structured, and action-oriented because every second is critical and matter. For example, a doctor may say, cardiac arrest, begin CPR, immediately, blood pressure is 80 over 50, prepare 1 milligram of IV adrenaline. This brief instruction allows each team member to immediately understand their role, reducing confusion and improving the teamwork. This also reflects the Shannon-Weaver communication model where a clear sender, message receiver, and immediate feedback minimize communication barriers such as stress, distraction, or background noise during emergencies. Now, let's move to the right side of my poster, which introduces the SBAR communication method. SBAR stands for Situation, Background, Assessment, and Recommendation. It provides a structured way to communicate important patient information. The situation explains the patient's current condition. The background provides relevant medical history. The assessment presents the healthcare professional's clinical evaluation. And finally, the recommendation clearly identifies the next action required, such as requesting an immediate medical review or transferring patient to intensive care. Research by Haig and colleagues found that SBAR significantly improved communication during patient handover, helping reduce medical error and improve patient safety. Besides structured communication, healthcare professionals also require strong communication skills. As shown in my poster, these include clear and direct messaging, maintaining a calm tone, practicing active listening, and using the read-back method to confirm important instructions. However, emergency communication also faces several challenges, including misunderstanding, emotional distress, delay response, and language barriers. If these issues are not managed effectively, they may compromise patient safety and treatment quality. Finally, ethical communication has a significant impact on healthcare outcomes. It enables faster emergency responses, reduces medical errors, improves patient survival rates, strengthens teamwork, and increases public trust in healthcare services. A good example is the COVID-19 pandemic, where hospitals relied on structured communication and teamwork to coordinate patient care efficiently despite overwhelming pressure. This demonstrates that effective communication is just as important as clinical expertise. In conclusion, ethical communication is the foundation of safe and effective emergency healthcare. By applying ethical principles, using structured communication tools such as SBAR, and working collaboratively as a multidisciplinary team, healthcare professionals can reduce preventable errors and improve patient outcomes. As highlighted in my poster, in hospital emergencies, communication is not just information, it is intervention. Thank you for your attention.